everyone. Welcome to the Have Faith and Heart panel discussion webinar. This is the second segment of a two-part series we're presenting around the Have Faith and Heart program here in West Michigan. I'm Jean Losarge-Bono. I'm the Executive Director for the American Heart Association, and we're excited to host this panel discussion about the power of the faith-based community, in particular the African American churches, to drive and improve health through our most vulnerable communities. I'd like to thank our sponsor for today's program for the Have Faith and Heart since 2017, Mercy Health. With two public health threats ongoing, the coronavirus and the impact of systemic racism, the American Heart Association is continuing its mission-critical work in these challenging times. I think this is why this discussion is so powerful today. I'm excited to welcome Beverly Austin, co-pastor for the Bethel Empowerment Church and board member for the West Michigan AHA Board, India Mans, community leader and also a board member, Dr. Karen Kennedy, family physician and regional medical director with Mercy Health, and Jocelyn Farmer, health equity manager of diversity and equity marketing for the American Heart Association. She's an active church member and our MC for today's panel discussion. Jocelyn, please take it away for segment 2.
So I'll now, India, I have another question for you. As a board, we've discussed how the prevalence of high blood pressure in African American communities are disproportionately affected by obesity as well as diabetes, and more likely to suffer from heart disease and stroke than their Caucasian counterparts. You've also had friends and even family members impacted by heart disease and stroke. Tell us about that, and how are you motivated to get the message out and improve treatment and care for Black and Brown communities?
Thank you for asking that question. I sit here dedicated the way that I am because of how heart disease has impacted me personally. My husband's father passed away when our son is 20 years old now, and he passed away when he was 9 months old. He was 57. He passed away in his sleep. And just a little history he was a man's man. So he had very little to do with, I would say, the daily care of my husband, Bill, changing diapers and stuff like that. That was kind of work for women. But when we had our son, at that time he was retired, and I've often heard that grandchildren change things. Son, he was involved in everything. He wanted to change his diaper. He wanted to give him a bath. He wanted to, anything that he knew or learned, it was because he had taught him. And the fact that our son has grown up as, his life, he's 20, and he will never know the love and the passion that his grandfather had for him. And, I just really hate that he will never be able to, although in spirit, I'm sure he will always be with our son. But the fact that our son never got to witness that on his own, it affects, is bothering me now. So as I'm telling the story, but so that's really important. But here recently in 2017, I had a line sister, a sorority line sister, who also passed away in her sleep. She was only 47, and heart disease took her as well. And really, really, I am in this field. I'm passionate about the heart disease part because of my father-in-law. But actually, Jean at the time was trying to recruit me, and I actually was helping her recruit other people with no intention to recruit myself. But my line sister passed away, and I could hear her in my ear telling me that this is what I needed to do. So I'm sitting here with you all because of that. And, I don't want anyone to have the experience that we've had with missing a grandfather, but more importantly, my husband. That was his dad. No one should have to lose their dad at 57. And, my line sister, 47, she has children that are in their 20s. They'll have to go their whole life without having their mother. They'll have children. They'll all the things that you want your mother around for. They won't have her there for that. So this is very important. And anything that I can do to create a different experience for other people, I'm here to do it.
So, India, thank you so much, and definitely want to, express my greatest sympathies to you and your family. We appreciate you telling your personal story, and it's just a reminder of the American Heart Association and those of us who work at the association and all our volunteers. While our work is so important, and it's encouraging, and it makes me realize why we fight. So we're here for you. We appreciate you, and we still have a lot of work to do, and we're glad that you're by our side. So in talking about some of those risk factors that affect our cardiovascular health, I wanted to just mention before we go through, we have a few more questions for our panelists, but just to bring and shed a little light on some of the other areas that affect cardiovascular disease and life in general. And we know them as our social determinants of health. I think all of us, we've heard about the social determinants of health, whether it's housing, education, unemployment, underemployment, access to healthy food, and stress. I could talk about all of those, but I think today I just wanted to hit on stress. Reason being is sometimes I don't think we talk about stress enough. And stress means something different to different people. And an example of that is, especially in the African American community, lots of times in the African American community, you have generations, living in one home. And sometimes there's one or two people that are taking care of the home. And that can be stressful. But because it's cultural, I don't know if we often see it as stress. We see it as duty, we see it as family. So it's very important that we realize it's okay to take some time for yourself. And I'll give you a personal example of that. I have a sister who she suffered a stroke 3 years ago, but thank God, she's still with us. She's a survivor. However, she lives in a nursing facility because some of the day-to-day things that we do and we might take for granted, she cannot do them. But I'm a long distance caregiver, and I didn't realize, because I felt like it was my duty until probably a couple of months ago, that it's really stressful. Well, will I continue to do that? Of course. But I also know that I have to take the time, even if it's able to, talk to the individuals in my faith-based circle, in my sorority circle as well, to say I'm stressed. What are some of those things that I can do? Take the walk, take the opportunity to meditate, take the opportunity to just sit quietly. So as we address the social determinants of health, and I know, another issue is systemic and structural racism. And that's one thing, and Dr. Kennedy, you mentioned this, it's not new. It's not new. I think it has been one of those things that the African American community we've lived with, which is a stressor that we haven't been able to address, because for a while it seemed like it is what it is. But I'm so excited and happy that God decided it's no longer going to stay this way, but it's going to take all of us, to make sure we're part of this movement. We are dedicated to our partners and our coalitions to make sure that we have the resources that they need to address the social determinants of health from a health perspective. So in the days and months to come, you hear more about those resources and how you can deploy them within the faith-based organization. We have a few more questions, so if I can turn back to you, Dr. Kennedy, I would appreciate that. So from your perspective, we see that the issues of the past several months of the pandemic, the economic challenges, the social injustice, the social isolation, politics are seriously impacting people's mental health. What is the reality of this? Stress on overall well-being, and what can people do to alleviate the stress?
So that's a big question, and I'm glad we do have some answers for that. I have the distinct honor, for example, of working for an organization that's faith-based. I'll just start there. So Mercy Health is a Catholic-based institution. You don't have to be Catholic to be a patient or work here. They're just based in that. I have found over the years that patients have often wanted to pray in the office. and it wasn't looked upon with disdain. No one said that, hey, you can't do that. It's not that kind of place. Not like that at all. So I've had a great amount of experience in patients doing that with me and vice versa. Because honestly, even as a doctor, with all the information we have and all of the techniques and medicines and everything, honestly, sometimes we really don't know ourselves. I'm going to be really honest with you. And growing up in the faith myself, I'm Christian, I enjoy doing that for patients. So even if you go to a place that isn't faith-based, you may want to look into whether or not there may be options for you to do that, or to find some other help in that way with your organization. Another is we do have a fair amount of screening for social influences of health, social determinants of health. So if people do have housing issues, food insecurity, where they can't really obtain good, healthy food for themselves or their families, if they're a victim of domestic violence, you know, any of a number of things, if they lost their jobs, you may not think that we in the medical community do anything about that or even care, but we actually screen that. We should be screening all patients for this. And we do have social workers, we have nurse care managers, we as clinicians can help in certain ways, especially with mental health. I don't know how many patients know that even as primary care physicians, we do know a lot about anxiety and depression, especially. During the last few months, anxiety, which has not been new, has been multiplied. How many fold? People who didn't have anxiety before now have anxiety. I mean, to the point where they need medication or something. So we can help in that way. Don't be afraid to talk to us about it. It is not a diagnosis of you're crazy. We don't write that in the chart. This patient is crazy. It is an issue like diabetes, heart disease, or anything else. And that's how we treat that. So we have a myriad of resources. Sometimes we can refer you to a counselor, to a psychiatrist, who usually helps more with the medication part of it. You know, the counseling is more the talking. We are also tied in with certain people in the church, such as Beverly. We are tied into community leaders such as India Mans. And these are trusted individuals, right? Before I said that sometimes the medical community isn't trusted. Hopefully we're more trusted now. But you know, we do try to refer to them as well. So we do tremendously care. And honestly, and I say this all the time, and my providers would say this too, we wish that patients would, or people in general, would seek out that kind of help before they come to us with their diabetes and everything else. Because honestly, it's kind of hard for someone with depression and anxiety to listen to me talk about the latest research on diabetes when they're just trying to find food to eat, or they don't have food for their kids, or they lost their job. So we try to make sure that we look at the whole person and not just this one medical thing and then move on to the next person. And there are also things, one last thing I'll say is, or two last things I'll say is, on the heart.org website, there are resources. And I know recently here in Michigan, there was a website and resources touted on headspace.com/MI, which is Michigan. And that's particularly for people who may have mental health questions, mental health issues. They want to seek ways how to just calm down a little bit, right? You don't necessarily have a diagnosis. So there are all kinds of free things you can do in your house also. By the way, last thing, I said last thing before, but truly last thing, we talked about exercise and helping some of the Life Simple 7. That does help with stress tremendously. Yeah. I know some women who actually took up boxing because they just wanted to get it all out, and it works. I mean, figure out what works for you. So yes, again, I'm glad we're talking about this, and I hope people take this to heart.
Absolutely. Thank you, so much. It is important to find what works for you. Mm-hmm. And that's what I had to do. I had to find what worked for Jocelyn. So thank you for reminding us of that. And it's okay to take up boxing or kickboxing. I can't kickbox because I'm not coordinated, but yoga works well for me. Thank you, Dr. Kennedy. One more question.
Acceptable.
It's acceptable? Great. Well, thank you. You made me feel so much better. So, Dr. Kennedy, Mercy Health has done a great job of pivoting with healthcare. What should someone expect if they need to seek treatment for heart disease or stroke right now?
So please know, if you don't already, that our offices are open. So during COVID, because we'd never seen this before, and I've been around for a minute, and I've been through 9/11 because I'm from New York, we were just crazed. So we shut down a whole bunch of places. Now we have certain offices that are dedicated to patients who have illnesses, and then others that want routine care. So if you've had heart disease or stroke, or if you want to talk about risk diseases, risks for those diseases, you can call your doctor's office, call the regular office number. We have shifted things around a little bit because things just had to change a little bit because of COVID. So we have different providers in different offices sometimes. Even I've transitioned out of my office, but there's always someone there for you. If you need to see your provider in another office, then please do so. Also, don't be afraid to come to the offices. So of course, I'm gonna say that because I'm a doctor, right? I don't know how many people know that there is not one single solitary colleague in Mercy who has gotten COVID through working at Mercy. If there's anyone that got COVID, it was usually from a community exposure of some sort, and they were able to trace that as well. So please know that we have your safety in mind. We care about you, and we want to be able to talk to you about how to avoid certain things related to COVID and otherwise. We also have virtual visits. So if you don't necessarily want to come in or you don't have time to come in, we've always wanted to do this anyway. So I guess one good thing that came out of COVID was, hey, now we have virtual visits. So we do things like this, where we talk to you by video and we can hear you. Sometimes we could see your rash. You could show us a lot of things if you have something in the mouth or otherwise. So we have that. We have telephone visits. We're going to start offering, hopefully soon, some like drive-through type visits too. So we're trying to be innovative. And there should be no excuse for anybody to not come in, because we take most insurances. Even if you don't have insurances, there are ways that we can see you. I was medical director, and still am a little bit now, of the Community Benefit Ministry that oversees patients such as that don't have insurance, and we do see you. So please come in. There is no excuse. Please come in and do that.
Thank you so much. And it's so important to hear you say that, Mercy Health is still open, and then talk about ways that, the telehealth or the drive-through ways to get, to get your health care, because I still think there's a myth out there.
Yes.
And your points can help us expel those myths, and definitely share it with the faith-based organization, because if it's coming from our faith-based leaders, then people are more apt to trust it. So thank you so much. Thank you so much. I think we all are getting a little nervous about the flu season, because we know that there's a possibility that we could see, a rise in coronavirus cases. Can you give us some advice on what we should do prior to the flu season this fall?
If we had simply washed our hands, I believe it was Beverly, if we would cover our mouths when we sneezed, if we did all the things we were supposed to do, maybe we wouldn't have been in such a dire circumstance as we're in now, right? So that's what I'm going to emphasize, and it sounds like a broken record, but you look both ways when you cross the street. You don't stop saying it because it works. So wash your hands, take your vitamins, get your sleep. Try to find ways to diffuse your stress. And I'm talking about flu still, right? Diffuse your stress as well, because that can decrease your immunity when you're like super stressed, and you can get more colds and flus and other things as well. Please get your flu shot. Now, I know that there are a lot of things I could say about this. The flu shot is not 100% effective. That doesn't mean that you shouldn't get it. When you cross the street, could you get hit by a car? Yeah, but you look both ways anyway, right? You don't stop looking both ways just because somebody got hit one day from doing it. So I would still advocate getting the flu shot. You cannot, and I'm going to say this again, you cannot get the flu from the flu shot. I hope everyone here on the board knows that, but for anyone watching, please, third time, you cannot get the flu from the flu shot, for the simple reason that it's not a live virus that we're giving. We give you a killed virus, as we call it, so that your body can develop an immunity to that. And then the next time the body sees the flu virus, it knows what to do, and the immune system knows what to do. That's what these immunizations do. So I would get the flu shot if you're able to anyway, especially if you're in high risk groups, if you're over 65, if you have diabetes, if you smoke, if you've had pneumonia before, if you are a child, of a certain age. All of these are risk factors. So I would do that. Continue the hand washing and everything else that everyone should know about COVID, and stay alert, stay aware, choose the resources that you choose to get information. As you were saying, Jocelyn, there are about 10 billion, you didn't use that term, but there are like 10 billion places that you can get information. Please choose the trusted ones. Don't go to something and go, oh my gosh, and
That's right.
please. Go to the heart.org website, go to your doctor's office, go to the CDC website, things of that nature. Actually, that can also decrease stress. Please do that during flu season as well, because people still die of the flu, so we can't ignore that.
That's right. That's right. Absolutely. Thank you, Dr. Kennedy. Once again, you're expelling so many myths. I hear it all the time that people say they caught the flu from the flu shot.
For the fourth time, you cannot get the flu from the flu shot. All right, I'm going to be quiet now.
No. Thank you so much. We appreciate you and all the great advice and messaging that you're giving us. It's just going to, if people are doing what you're asking them to do, then we will fare better. This question kind of goes well with what Dr. Kennedy just said to us. So we discussed how the churches are one of the most effective means in creating positive change in the Black community. What actions do you advise the churches to take right now, before the flu season hits? But not only the actions, how will that be conveyed and communicated to the churches, since some of us are still not in the sanctuary?
Well, one of the things that I would like to say is that the leaders have to lead by example. And what I mean is just protecting ourselves and our health. We did a 45-day challenge, and it was just cutting sugar out of your diet for our people. Mm-hmm. And so we did that simply because we know that cutting sugar out of your diet helps strengthen your immune system. They didn't know that. They just liked a good challenge. And so just coming up with creative things like that as the leaders for your people that will really help them in the physical and the natural. Number one is a tremendous responsibility that we have. And then number two is making sure that, and this is one thing my husband already does, he stays connected with the CDC very often. And so we have a call with our church once a week. We have a private Facebook group with all of our church members, and he comes in there and he checks in on them and he gives them new information that is out there. But here's the thing for us. We don't want to just live, especially coming into fall, worried about the increase and the spike. We want to live prepared. And so that's one of the key things that we want people to do is live prepared. Don't live in fear of it coming. Live prepared in case it does come. Because we know there's a great possibility that there is going to be a spike, that there is going to be an outbreak. And so what we're doing when we're talking to our people in our live Facebook groups, and then again, those small groups that we have, and then we, just various information, but we're bringing information. Yes, this is the statistics, but here's what you can do to live prepared and not live in fear. And so I think that's one of the key things that we want to provide people is information so they don't have to live in fear. I'm so concerned with the level of fear that is being disseminated among just people really around the world, but we can live prepared and we don't have to live in fear. And if we take care of our bodies also, we may get COVID, but if your body and your immune system is in a strong enough place, it doesn't mean it has to be unto death. And so we want to really encourage our people through our Facebook groups, through our small groups, and just through very small conversations that we have. We want to make sure that they are prepared and again, living healthy, both mentally and physically. So that's the information that we're making sure in his preaching on Sundays that we have health information in there. In our Bible studies, we're making sure we have health information in there because we want you and we want us to be holistically sound, mind, body, and soul. But we want to make sure it's starting with us so that we're not giving fear and that we're not operating in poor health ourselves.
Excellent. When you talk about being prepared and having a faith-based conversation, it's just so true, and it resonates because our teachings say to prepare us for our transition to our heavenly home. We prepare for that.
I don't want them to prepare to go. I want them to prepare to stay.
But no, I say, but we make that preparation, right? So we know what preparation is. India, I have a question for you. Why is the initiative, I know you work so diligently with the Have Faith in Heart initiative, So why is that initiative so important? And how can we encourage other churches and sponsors to get involved?
I do want to answer that, but I want to say just a touch on a couple points that I've heard kind of in the conversation, particularly around mental health. I do think that it is important to often to be in tune with yourself and to be able to acknowledge when there may be challenges. And you know, sometimes we look for dramatic things or things like that. I was just having a conversation with Jean yesterday, and I know for a fact, it took a minute, but I know for a fact that I am suffering from social isolation. I'm a very social person. I enjoy attending meetings and having face-to-face contact with people. My buddy Beverly here on the call, she's reached out to me several times. I mean, I've developed some really bad behaviors where you say, like, I'm socially, I know that I'm suffering from social isolation, but then I'm not responsive. So if people try to reach out to me, I don't respond. And so it's almost like I'm cocooning into this world of just promoting the social isolation, making it worse. And maybe I don't need to talk to a healthcare person or anything like that. Maybe it's not that severe, but I think it's important that we are in tune with ourselves and that we are able to identify when things are a little off and being able to admit that that may be something that's going on with you, because you know often we run to take care of other people or identify things within other people, but sometimes we are very slow to identify it in ourselves. It's affecting my motivation. It took everything I had all the way up until 10 minutes before this started. I was coming up with all kinds of reasons why I didn't want to be a part of it. I mean, I have my motivation. I have virtually none. And so when we're asking people to take care of themselves or better, you know, to take measures for better health, to better prepare for COVID, or just to live a better life, as Beverly has mentioned, it's kind of hard to do when you don't have any motivation. And if you find that you don't have any motivation, you understand why you don't have any motivation. So I'm just kind of putting that out there because sometimes if we, you know, we can see that maybe somebody else is having a challenge, we're better able to accept that challenge within ourselves. And then I also want to mention we're not on this call per se to talk about wearing masks, but I do want to highlight that everything we talked about on this call, if we're not wearing our mask right now in this season of whatever we want to call it, we're not, you know, we're not fully protecting ourselves. We can eat, we can improve our immune systems, we can run around the block, but right now it is extremely important that we wear our masks and that we wear them correctly. I see a lot of individuals wearing the mask, they have their nose out. And we know that you're defeating the purpose if your nose is not covered. Both your nose and your mouth should be covered, and you should have the mask when you're in the presence of others. I see a lot of young people walking around without these masks, and I can understand that they don't want to wear the mask, but a lot of them go home. You mentioned, Jocelyn, multi-generational homes. A lot of them go home and they go to grandma and they go to older. You were asking me about why it's so important and how we can encourage others to get involved. I believe that it's important because it's just important that we're all healthy, right? And we need to care and take interest in ensuring that everybody is healthy. Just because something's not impacting you directly doesn't mean that it's not important. And so anything in terms of healthcare initiatives that we can do to create better outcomes for individuals, we do need to get behind to support that. But we do know that heart disease and stroke is as prevalent in the African American communities of color because of a whole lot of reasons, social determinants and just levels of stress and just a whole lot of reasons that make this a bigger problem for us. So this is why this is extremely important that we support this, but a healthy community is in everybody. right? That's everybody's problem. And so when we can have everyone in our community healthy, it's a better community.
Thank you, India. And once again, thank you for, sharing the personal story about the social isolation. And I think sometimes people may not even realize that that's what's going on with them. So as we continue to talk to not only just our congregations, but people in the community, look for those kind of key factors and then figure out what is it that you might be able to do. Because when a person is not motivated because of social isolation, it's very hard to help them find a solution. But we can definitely work to do that as well. What message do you want to share with everyone who's listening to us about the American Heart Association mission and our work to fight health inequities?
Well, what I want to say is that your heart matters. And I want to say this, especially from the faith perspective, is your heart matters both in the natural and in the spiritual. So the same way in the natural, you need to pay attention to your symptoms. You need to pay attention to your blood pressure. You need to pay attention to various pains and aches in the natural. We also want to tell you that in the spiritual also. So I love this particular initiative. I love the name first and foremost, but having faith in heart, because your heart really is the central intelligence station that really governs the rest of your body. So listen to your heart. Anything you see with AHA, anywhere, wherever you are, plug in, whether it be with your time or your talent or definitely your treasure. Support AHA because your natural heart and your spiritual heart absolutely matter. Get plugged in to anything American Heart Association does.
All right, I'm just going to say amen to that, and and then move to India for your answer to our question.
I'm just so appreciative that the American Heart Association is taking time to have a program like Have Faith in Heart. So often, healthcare disparities are just glossed over. They are the root to so many problems that we have within our community. And the fact that an organization realizes, but not just realizes it, but they actually take initiative and care to create a program to address it. They listen, right? So you tell them this is the best way to get the message there. And they're like, okay, we're there. We're here to bring the message. So I think that is extremely important.
Dr. Kennedy, I'll have you round us out on our last question.
A lot of people I talk to, patients and otherwise, really want someone to kind of go along the journey with them. They're not quite sure how to do it on their own, or maybe they're not motivated to do it on their own. Just that one strong person that says, hey, let's go for a walk. Or, this is how you make this kind of salad. I'm going to do this with you today. Just choose someone else to do things with, and maybe we can build a huge community throughout the United States, because the Heart Association is going nowhere, and they're not going to stop what they're doing. So why not be a part of it? Go right ahead. Help yourself and other people. Join us.
Absolutely. Thank you so much. To the esteemed panelists, you are great advocates for the Heart Association. We appreciate you so much. I'm definitely personally appreciative of the dialogue we've had today, and the fact that I had the opportunity, God decided that I'd spend a part of my day with all of you to also reinforce the information that I know and still be a voice for our faith-based organization. So once again, thank you so much. And I'll now turn it back over to you, Jean.
I think this has just been an amazing conversation. I'm so thrilled by how much was shared today. Jocelyn, thank you so much for emceeing and leading this discussion. I think that India hit it straight on when she said that we care and we need to be working with other organizations to make a difference. Dr. Kennedy, I loved how you said, if you learn something, share it with others, because there are so many people that need to hear this information and to get involved to make a difference. And Beverly and Jocelyn and India, I think that's why our outreach is so important to the churches, because they're so great at sharing and communicating and being that source of trust. So I think a lot of people may not know that the American Heart Association has really been one of those champions for health equity for everybody for nearly a century now. And with all of this going on today, we're more determined than ever to eliminate the barriers of health and address those social inequities. So I am so grateful to all of our panelists for joining us today on this important discussion. I'm motivated and really honored by the local churches and the First Ladies in particular for being such a powerhouse behind helping us build a healthier community for all. If you're interested in more information on the Have Faith in Heart program, please feel free to reach out to me at jean.lesargebono@heart.org. And again, to everyone, stay safe, be well, and thank you so much for joining us today.